Welcome to the Innovations in Clinical Implementation podcast, the Ovation Lab and A4M series designed to help clinicians move from emerging science to practical implementation. We're here live at Longevity Fest 2025, joined by thousands of practitioners focused on advancing functional medicine, immune resilience, and health span optimization. I'm Dr. Lexi Gonzales, Naturopathic Doctor, and Senior Clinical Implementation and AI Specialist at Ovation Lab. I'm joined by Chris D'Adamo and Dr. Jocelyn Strand, and I'll let you go ahead and take it away.
I'm Dr. Chris D'Adamo. I'm an epidemiologist by training. I lead the research at Ovation Lab, and we're incredibly excited to be here with Dr. Jocelyn Strand, who's going to be speaking about biofilm-focused clinical strategies that support gut balance, immune function, and whole person health. So, a little introduction. Jocelyn is the Director of Clinical Education and Research at Biocidin Botanicals. She brings a deep reverence for botanicals and a strong passion for science to her work, overseeing research, training clinicians, and speaking internationally on topics like the microbiome, biofilms, and immune resilience. A naturopathic doctor by training at Bastyr University, she previously spent over a decade in primary care, specializing in GI disorders, Lyme disease, and autoimmune conditions. So welcome, Dr. Strand.
Thanks so much for having me. I'm very happy to be here.
Our pleasure. So on biofilms, I will start from the very top. What are they? How prevalent are they, and where do they tend to occur in the body?
I mean, really great place to start. So biofilms, I think the easiest place for us to identify biofilms is in the mouth. So everybody gets fuzzy teeth, especially if we have too much sugar or we go too long without brushing our teeth. That's a biofilm. And the purpose of a biofilm is really to protect the microorganisms that are underneath it. So it is created by microorganisms. They can be either beneficial or pathogenic species, and that's where we need to get really careful about assessment. And they can become, well, let's dial it back and say biofilms, why they can be an issue is because it's like an invisibility cloak, what they create around them, and then they're not available for our immune system to have activity against them. And they can survive things like light and in the external environment. I'm talking about in our body, how they live, but they're everywhere too. They're in streams outside, in the outside world as well.
Surgical instruments and stuff like that even, right? All
yes.
kinds of things,
yep,
right?
They can be, yep, exactly. And one of the main issues right now for antibiotic resistance and sort of drugs of biggest concern, or bugs of biggest concern in the world right now is because of biofilms. They're good biofilm producers, and then antibiotics can't get at them, antimicrobials can't get at them, our immune system can't get at them. And so there are, like I said, there are good and bad bugs that can live in a biofilm, but kind of balance is the name of the game. And so we have them in the mouth, we have them in the ears, the skin, the gut, of course, is kind of the primary area. We have most of our microorganisms, the vaginal tract. They're actually everywhere in the lungs as well. We used to think a lot of these areas were sterile. We now know that we have a microbiome and even biofilm there.
Now, how does this tend to present clinically when that balance tips in the wrong direction and there's more pathogenic biofilms? What do we often see? What are some of the manifestations?
I mean, it's a really great question, and it will depend upon the area in the body, right? But again, if we focus in the mouth, if we talk about the mouth, we think of that sort of fuzzy teeth, and then we think of things like gingival inflammation, periodontitis. It can cause cavities as well. So there are certain microorganisms that are really common biofilm producers that exist in the biofilms that will create cavities, like strep mutans is one of those microorganisms. Candida is one of the main producers of biofilms in the mouth as well. So, and then it can translocate from the mouth to the gut. And so they think of whatever Candida can cause in the gut. So gas, bloating, SIBO, SIFO for Candida, I guess, and it can cause motility issues. It can cause a whole array. And the reason it can become a problem if we get those sort of pathogenic biofilms is because they're constantly producing inflammatory mediators. And this will sort of kind of dovetail into some of the other things that we might talk about today, is that they're sitting behind that invisibility cloak. Our immune system is firing at them. It's ineffective against biofilms, so our immune system can't break down the biofilms. Instead, we create this collateral damage of inflammation. The microorganisms are producing inflammatory metabolites and toxins, and also the biofilms are very sticky, and they will hold on to whatever toxins are floating by as well. So they can become a problem for any number of those reasons.
Wow. And, we're at Longevity Fest, and one of the big topics around longevity is this idea of immune resilience. And so can you talk a little bit about why biofilm management is becoming increasingly important for addressing this gut-immune interaction, especially in the context of longevity?
Absolutely. And so I think inflammation is what I think of course, right away. It's like free radical damage produced anywhere in the body. And of course, we have most of our immune system in the lining of the gut. So you're asking specifically about the gut. If we have biofilms in the gut that are housing pathogenic microorganisms, we have things like lipopolysaccharides or LPS being produced that will be consistently producing inflammatory mediators that then will draw down our ability to detoxify because it has to be cleared by the liver. LPS is primarily cleared by the liver. So we think of detoxification being compromised and inflammation going up. And also, of course, we get exposures to any kind of infectious illness as well that's there. So anything that is opportunistic to anywhere on that spectrum, opportunistic to pathogenic, if it's growing in a biofilm, it will be consistently creating inflammation. And I guess that's the primary, how I think of it with longevity in general, is that we're drawing down our own resources in order to quench free radical damage or to kill off an infection, rather than using it to keep our tissues healthy and sort of health span instead of working on staying healthy instead of
Yeah, and as we've kind of talked about biofilms before and feeling slightly terrified about where these biofilms are living both inside of me and then in my environment, with clinicians who are unfamiliar with your work, we're here to kind of talk about Biocidin and the solution that it offers. So what distinguishes Biocidin's approach to biofilm disruption and microbial balance?
I mean, it's a really great question. I think this is, as a naturopathic doctor, and I'm sure you can relate, and I think we all can agree that it's really, we're not here to wipe anything out, right? We don't want to have to come in with napalm and wipe everything out and then restore afterwards, right? So one of the beautiful things about botanicals and why I have the reverence for botanicals is that it does really help to restore balance. And we do have, as you know, Dr. Adamo, you know about some of the research that we've done showing that it doesn't negatively affect probiotic abundance when we use botanicals, at least Biocidin doesn't seem to affect that probiotic abundance. And so we end up restoring balance. And I love that as a paradigm for just rather than kind of wiping out and then having to restore, is coming in and restoring balance. And now I've lost track of the question. So
well, that's what differentiates it. Because there are drugs. I mean, I think you do.
Thank you.
There are drugs for this. There's other things, but the fact that we did some clinical work, a small study that we did a number of years ago now that showed that many of the probiotic bacteria that we want to have in the gut were preserved, while some of the pathogens were
exactly.
So that's pretty. And then there's the preclinical study that's under review right now.
Yes.
So there's some interesting work showing that.
Yeah, and also I think a differentiator is that Biocidin, anytime you have a plant, it has more than one activity. So rather than I'm going to use a pharmaceutical as an example to compare it with, coming in and doing one activity, killing a certain kind of bacteria. The plant will have antimicrobial effects, and not just antibacterial, but antifungal, antiviral. It also is an antioxidant. It supports host immunity. We have research showing that. It also disrupts biofilms. That's the research that we're doing, right? But there's also extensive research on essential oils in particular, and their ability or their capacity to disrupt in biofilms. So it becomes a sort of synergistic approach where you're not just going after biofilms, you're not just an antimicrobial. It has this capacity to really enroll the human body, to also and help with the health of the human body, and then also bring down the pathogen load and address the biofilms. And that's really important. One thing I didn't mention is that when there's a biofilm, I kind of alluded to that, but it can be they can have to have up to 5,000 times the amount of antibiotics to kill a pathogen that's behind a biofilm. So this is it can cause refractory illness. And how that might show up, and I don't know if you're going to ask me this or not, but how that might show up is that if you're in a clinical practice and someone feels better when they're on either an antimicrobial or an antibiotic, but then it keeps coming back, then you want to make sure that you're addressing potential for biofilms.
And does that apply to antivirals as well, since there's other microbes that can be contributing to the biofilm production? There's
a viral load in biofilms as well. So yes, it can be that if you don't clear the biofilm, that it's hunkering down there. It's an opportunistic organism. I don't even know how to refer to a virus exactly, but yeah.
And so in addition to this case that you just gave in regards to people feeling better on antimicrobials, what are other clinical patterns, histories, or labs that might suggest that biofilms are involved? And when should clinicians proceed with more caution?
It's a really great question. And so I think there's sort of two distinct groups. There's sort of the people who are really interested, they're pretty well, and they're interested in longevity, or they're it's kind of basic wellness. And then I think all of us as clinicians have had those patients like with Lyme disease or mold toxicity that are really sick. And so there's a whole spectrum of patients that you might see in your office. Everybody's got biofilms. It's just whether they're pathogenic and how pathogenic are they. And so mystery illnesses is how I would think about it. If you can't figure out why, I think another one is when people go in waves. When they're healthy, they feel better for a while, then they feel worse again, and it's just mysterious. They can't kind of pinpoint with their trigger. That can be a biofilm source as well. And then I think anyone that's got a chronic illness of any kind, because of what we just discussed, so 80% or 85, I think, percent of people have biofilm involvement with chronic disease within 2 weeks of an illness. So if you have someone with a chronic disease, then you have a biofilm component to that chronic disease as well. So I think, does that answer your question?
Yeah, and it opens up, we could probably dive more deeply into that for a whole separate podcast, actually, but we'll move on to the next question for the sake of time. So knowing that, what are your practical recommendations for clinicians on how they might implement biofilm-focused protocols from initial assessment to monitoring outcomes?
Well, this is one of the things I love about Biocidin, is it's really easy to titrate. So it's an easy place to start with a single drop. And it is something, I mentioned the people with Lyme and tick-borne illness and mold. What I didn't say that you asked me before, and I'll say now, is that those people are the ones that you need to be careful with, even when you're working with biofilms, but when you're working with antimicrobials in general. And oftentimes antimicrobials are also anti-biofilm. So any other antimicrobial will likely have some activity on biofilms as well. And so they may have what's called a Herxheimer or die-off reaction, and so they need to be handled very carefully with binders, sometimes with drainage first, sometimes even before you introduce the anti-biofilm. But that subset of people aside, working with a liquid like the Biocidin makes it very easy to titrate and just start low and slow, and then just gradually increase, and then people tend to tolerate it very, very well. And I think I would say maybe 80 to 90% of the people in my practice never even noticed when they were taking Biocidin. But I also think not everybody's as tuned in to their bodies, so maybe they get a headache and they take something for their headache and they don't realize it's going to go away in a day because it was a biofilm. So, just some awareness on the clinical level, so you can support your patients with it.
I think a lot of us are familiar with the 5R protocol. So where might something like Biocidin fit in a protocol of someone that's going to go through all 5 steps? Or do you feel like this is kind of a separate and aside intervention?
No, I think it fits very perfectly into the 5R protocol as part of the remove aspect, right, of removing the pathogens, but also the biofilms. And really, they can be root cause. The biofilms can be a root cause of a source of reseeding of pathogens over and over again. So addressing those is where I would kind of firmly place Biocidin in the remove category.
I mean, it's a really easy ask to start with 1 drop when you're starting the protocol. So I think that's a huge benefit for adherence and compliance.
Yep, and it tastes pretty good. Like sweet pizza is how I tell them.
Sweet pizza? I like that.
Oregano and garlic in a glycerin tincture. It's like,
I thought of it that way, but that's pretty good.
I never had any children even. I had one adult, but I was like, well, you're just going to have to take it. I'm sorry. And we do have it in a capsule, but what I love about the liquid, too, is that you're working with the oral microbiome and biofilms. So rather than taking a capsule and treating in the gut, you're starting in the mouth and treating the whole GI tract starting in the mouth. And that's a really important aspect because we do swallow what's in our mouth and it inoculates in the gut.
We're going to talk plenty about that with our study, too.
Yeah. Should we talk about the study?
Let's do it. I mean, I think, this is our most recent study, but we've had, one of the things I love about Biocidin is that there is this robust body of research that have continued to do. Which is fantastic. So the one that we're doing now that I'm really excited to be working with you on is looking at Biocidin liquid and oral biofilms in healthy people. So this is going to apply to basically everybody. So we talk about the generalizability to just about every patient's going to be out there. So we're going to be looking at how does Biocidin liquid at label dose, how does that affect a variety of biofilms in the mouth after just 2 weeks, which I think is pretty cool too.
Yeah, I love that.
So this is something that again, as a clinician, it's so I think the clinical implications of this would be massive for those that are suffering from chronic disease, even just those that, again, you brush your teeth, you do all the right things, still, these biofilms are out there. So I guess my question would be, your thoughts on this, and then the final point about, biofilms in the mouth and how that may contribute to other problems elsewhere, and how thus this study could then, give us some inference across the body.
Yeah, I think what I love about the way that the study is designed is that we're looking at microorganisms that are in the mouth, obviously not exactly the same milieu that we might see in the gastrointestinal tract, but all of the bugs that we're looking at actually do translocate and can become pathogenic in the gut. So a really nice aspect to this is that we are actually looking at bugs that can become pathogenic in the gut. And that was, we did our due diligence on that, right?
Any good study has a lot of due diligence.
Because we want to make sure that we're actually presenting, solid ideation and good science at the end of the day. And I think that was exciting to me to have the conversation with the lab that's doing the research for us, and to get really clear on understanding it. And what's different, I think, about this testing that is exciting for me versus other testing, oral microbiome testing, is that we're actually scraping the biofilms off the teeth and the gums. We're not doing a salivary, which is a different thing, like Bristol and Spectrum, which Spectrum is actually, we're working with them, right, on this testing, but the typical oral microbiome testing is saliva. This is really actually going after the biofilms, which I think is a really different thing to look at, and I'm excited about seeing the outcome on that.
So are we.
And then the second half of the question was, why is it important, right? What grows in the mouth, and how can it translate to the rest of the body in another way? And I think I already mentioned this, and I'm not sure if this is what you're after, but when we do, so we have 10 billion microorganisms or bacteria in 1 milliliter. I have to think hard on that. 1 milliliter of saliva, and we swallow a liter of saliva every day. So if we do have overgrowth of candida, or some of the ones that we're looking at are Fusobacterium, nucleatum, or some of those other pathogens in the gut or in the mouth. They can translate to the gut, and they can cause disease in the gut as well. Some very serious illnesses.
It's a nice pro I think a lot of people overlook.
Yeah, we talk a lot about oral health, but I don't think we've actually gone into the realm of oral biofilms, so that's super helpful. Can you go into what are some of the educational resources, such as papers, webinars, and materials from Biocidin Academy that you'd recommend clinicians look into if they want to deepen their understanding of biofilm management?
Well, I know for this podcast in particular, for the listeners to this podcast, that we're creating a special landing page so that everyone can access the research and all of the resources that we provide to our practitioners that have accounts with us. So you can have an account with us, and we do ongoing educational content. But there you'll find protocols, both oral health protocols, pretty much every kind of gut protocol you can imagine, gut-brain axis, gut, GLP-1, how to work with GLP-1 in the gut. So many different educational resources on that website. And there is a biofilm, I think that will be connected to the landing page for this. They'll see, co-created with Dr. Paul Anderson, who's kind of the biofilm guy in the industry. It helped us create a questionnaire for patients so that you can, if you're wondering what's the likelihood that this patient has some sort of biofilm involvement, you can have them fill out the questionnaire. And assess that as well.
That's great.
Lots of different resources, lots of webinars, really great information on the website. So.
Well, thank you both for joining us for the Innovations in Clinical Implementation podcast. This episode, as well as a full archive of this sessions, will be available on demand for practitioners starting early 2026. And thank you for joining us.
Thank you so much.
Yeah, thanks, Jocelyn.
Thank you.
Biocidin Botanicals has been trusted by healthcare practitioners for over 35 years. Our flagship Biocidin formula blends 18 botanicals to support microbiome balance and the removal of unwanted biofilms in the oral and gut environments, promoting whole body wellness and comprehensive patient care. We're now partnered with Cellcore Biosciences, offering practitioners an expanded toolkit of products, education, and exclusive events designed to elevate your clinical practice. For a limited time, Ovation Lab listeners get 15% off. Visit biocidin.com/ovationlab. Biocidin Botanicals, a natural solution for our times.